here from Cornea Revolution-Motwani Lasik Institute. Patients ask us, and even doctors are sometimes not aware, that having cataract surgery can cause corneal irregularity. That's not anyone's fault. It's just that the incisions that are made in a cornea to do a cataract surgery can sometimes have an effect that it causes an irregular shape. Now, if the surgeon puts the incision in the wrong place or not close enough to the edge, that adds to the problem. We've seen that in a few cases. But you can have changes to the cornea that can lead to the vision not being right just because of this refractive effect, this irregular effect to the cornea that happens just by the cataract incisions. Is it a lot of the time? No, it's not that common. It does happen though, because there are so many cataract procedures done. I mean, millions of people have this procedure done, and have had this done. So it is one of those things that just the incisions themselves can create an irregularity in the cornea, and when they do, then the vision just doesn't come out right, even though the numbers may sound right and the doctor's a little confused. And it turns out we can fix that. What we do is we reconstruct the cornea to get rid of the irregularity through those incisions and clear the vision again. We've done that for quite a few patients. And I'm just kind of letting people know that this can happen, because to my surprise, I've actually talked to some doctors who just claim it never happens, and that is just not scientifically valid. And so it is possible to end up with corneal irregularity after an even well done cataract procedure. It's not common, but it can happen. That is something that can be fixed.